Very much. I'm gonna now open it up to the public, to the discussion with the committee, and we have about 20 minutes left. Yes. Yes, go ahead, Michael. Yeah.
Sarah, maybe it's because it's late, but I don't think many people on this panel have a clue what the development lab is. And I think you missed an opportunity here.
I think you're right.
And I'm a little biased, I tell the committee, because we're one of your universities that you fund. But I really think you should be given 2 minutes more to talk about the development lab. As Megan and I discussed, it's a very unique initiative that AID took and is under some jeopardy as far as I know. And I just think briefly this committee should know about it. We don't have a lot of time, so maybe if they would give you 2 more minutes or 3 more minutes, 1 more minute, you could just say what it is, because I don't think most of us know.
Yeah,
I can.
And how much money?
I mean, you have a lot of money,
Sure.
so you should also indicate the size.
Yeah.
We don't have a lot of money. The U.S. Global Development Lab is a small entity within USAID that is focused on bringing science, technology, innovation, and public-private partnerships to our work at USAID, as well as to the broader development sector. So we have a two-part mission, which is to disrupt and source innovations, as well as to really look at how we can be changing the development enterprise. We are less than 1% of USAID's budget. We have approximately $100 million a year.
Thank you very much. That was even less than 1 minute. We'll start the questions.
Anyone who wants to learn more, I'm happy to tell you about it afterwards. Thanks.
Thank you, Valentin.
Yeah, mine is less than a minute. It reminds me all of this to what happens in medicine today. We have 5 imaging technologies that are being used to address the most sophisticated aspects of neurovascular and cardiovascular diseases. And many of our young people, when they are finished their training, they come and say, I want to do multimodality imaging. Let me tell you the result of this. This has been going on for 5 years, and I am the editor of the Journal of the American College of Cardiology. And paper after paper that comes, that is the best papers, is when technology has been used as a consequence, not as a driving force. And I'm saying this because this committee we have a huge challenge. What you guys presented is incredible. But unless we have very clear what we want to achieve, we have to be very careful that we don't get lost into all these technologies and we begin to think by the technologies available what we are going to do. And it's just a point. I think we have to think the other way around and use all these assets, but be clear what we want to do. That's basically a comment.
Can I follow up on that briefly?
In fact, it's your turn.
So the first conference call we had on capacity building, you made an incredible point on creating registries. And when you go back and say how you can use these technologies, registries is at the bottom of understanding everything that happens in a particular place or with a particular problem. But because we want to be agnostic to the disease, I think that the development of infrastructure, the development of digital technology, and the creation of these registries is to me the greatest challenge. And I attach this sort of agnostic because I developed a trauma registry in Guatemala, and we took the devices to the hospital, and we gave them to the residents, and we expected them to fill the data like you said, and we fail. And we fail because they're busy, they're taking care of patients, and like you said before, it's not always that easy to change behavior. So in the big context, how are we going to collect the data that we need and how we make it agnostic and how we best use this technology, I think is the greatest challenge. And registries continues to be at the bottom of understanding each and every one of the reasons why we're here. So it's not a question, but it's a comment because every one of you use sort of music to my ears on using real-time data collection, which I think is very difficult.
So I just want to say I 10,000% agree. We have to stay laser focused on our development outcomes, and in this case, our health outcomes. And I think the message I wanted to share was that the health sector globally is evolving to embrace technology. That is happening, and we need to be much smarter about how we are doing that. And so we need to make sure that as that happens, that we're acknowledging that it is about behavior change and that it is about being smart about interoperability across partners, and that we have the right skill sets at the table to advise on this in a successful way. Because I think that in the absence of doing that, we're going to continue to see evolution to embrace technology, but we're just going to miss so much of the potential impact of that without doing it in the right way. Thanks.
If I could just come in, can you hear me?
Yes, go ahead. Go ahead, Peter.
I was just going to say, my recommendation would be that your recommendations should be framed in terms of technology.
We need you to put your phone up again. We can't hear you.
We've always, how about now? Can you hear me?
Yes, very nicely.
Okay. I just wanted to say, I would recommend that you don't recommend in terms of technology. From the beginning, we've always focused on something we call, quote unquote, integrated innovation, which is the combined application of science and technology, social innovation, business innovation, and financial innovation. And I should have mentioned that actually up front, but sometimes you need social innovation and innovations in delivery, sometimes you need technology. It's never only one thing. I mean, even mobile phones have behavioral and social applications. They have technological elements. So I really think the focus ought to be on innovation and integrated innovation. And that's a precondition, I think, to sustainability and scale. And it avoids the techno-gizmo-geek critique, which I think is fairly taken on development and development innovation. And I also think the second point that was in the original speaker, I don't know if that was Valentin, I mean, you made 2 points. One was this one, I think, and then the second one, as soon as you can, you have to switch from the supply side of innovation to the demand side of innovation. And you have to think about demand right from the beginning, and social innovation will help you to do that. I mean, there's a point where you're funding things, you're funding a pipeline, but then you got to get to a tipping point where there's demand uptake, especially from countries. And that's why the Global Finance Facility is such a great example. So I just pause there. I just want to be very brief and reinforce, I think, the direction of the conversation.
Thank you. Aaliyah?
I have a question about the gizmo part. I have one question about the digital technology, and then one question specifically for Peter. The question about the digital interventions is I think Ed mentioned this idea that if you're using a personal phone, then and the data are being pulled into the cloud and being stored there, that there's a risk. And I don't know how we do it in this country in terms of HIPAA regulations, but it seems to me like that's a big can of worms that would need to get addressed from a regulatory perspective in terms of what is legal and what's not, and how much information you can collect, and then how secure that data is. So that's the question. That's that question. And then for Peter, the question is, in some of the conversations we've been having about children's health, we're extending to thinking about children thriving, not just the survival, but thinking about thriving. And I know Saving Brains has been really very instrumental in terms of putting that on the map. And I was curious if you could just talk a little bit about what your rationale was for going beyond the survival and going into thriving. Thanks.
Yeah, I would just say that's actually the biggest impediment to adopting mobile solutions. Germany is a nightmare to deal with. I hate to say one particular country, but they've caused a lot of consternation, even going so far as to say things that would be accepted in other countries may not be, acceptable in their country. But it boils down to, essentially a process of educating about, first and foremost, informing what you're going to do with the data, limiting what you're going to collect in the first place, and then being able to articulate exactly how you're going to use that. In the context of a clinical trial, that's pretty straightforward. You can put it in the informed consent, and so having that understanding to kind of continue to encourage them. And then there just needs to be essentially some commonality in recognizing the fact that there's no longer there used to be a conversation of could you put data in the cloud and servers versus it's physically at a location. Well, you can control access digitally just as well as you can because you have it under a lock and a key in a file cabinet drawer. And so I think those kinds of things somehow get blown out of proportion, and it's I think there is a lot of momentum on the regulatory front already, and so I'm not as concerned about that. But as far as to the other question that your colleague had, the guy sitting right next to you about registries, the ability to just assume that data is going to be collected however institutions are going to collect it. That's why my comment was just make some, incentives to exposing whatever data you have available and let others choose how they're going to pull that. Some of it will be crap and others of it will be all right, but let them start to pull that data together. But exposing what you already have is the first thing in the first place. And so ideas and efforts to encourage and not get penalized for exposing what you already have are a good place to start, because then you're not required to change behavior. Just allow them to work the way they want, surface it, and let smart people figure out how to parse that.
I just want to add quickly, we at USAID interface quite a bit with governments on this issue. This is something that comes down to national government policies, and nearly every government in the world is grappling with data privacy policies at this point. It does mean that quite a number of countries that we work in today are not ready for moving to electronic medical records. There's still quite a bit of great work that can be done using digital technologies in health that doesn't get to individual patient data. For example, pinging health clinics via cell phones and saying, do you have a sufficient supply of vaccines that we can then respond to in real time? That kind of thing.
Peter?
Great. And just briefly on your second point, raise your hand if you've got kids. And keep your hand up if you're satisfied with those kids merely surviving. You couldn't care less what happens to the masturbation line. I mean, parents want children to thrive. They don't want children merely to survive. And that's why we focused on Saving Brains, which is a program that's put about 40 million Canadian into about 70 innovations that take an integrated approach to child development. And that actually is the innovation program. We support nutrition and other health interventions and study the impact on kids' brains and their thriving. We support learning and stimulation. As a general internist, I was surprised that the signal strength you get from responsive parenting actually sometimes is stronger than nutrition. And we support child protection. And it doesn't matter if you're well-nourished, if you're a child soldier in Uganda, or if your parents ignore you the whole time. So it's an integrated pipeline of about $40 million and about 70 innovations. I actually think here is a place, if you're getting into children, it's a recommendation you can make. I think that the U.S. government has not really taken the right approach in development to focus only on child survival, because survival is so important, not only to parents, but also to the economic outcomes of countries. You're really talking about 1 in 3 children in the world, in some countries 2 in 3 children, and a total cost of about $177 billion a year in the developing world alone. So this is the first human skills capital development program that you'd want implementing the first 1,000 days of life. And finally, the saving grace, though, is that many things that save lives also save brains. An example is kangaroo mother care, which I used before. Another example, I see Gisela is sitting right in front of the camera in GE, hypoxemia in childbirth. GE has been focused through groups like Hewlett-Kelly in finding innovative business models to bring oxygen to newborns and to others. I mean, if you're hypoxemic around the time of birth, you may die or you may not thrive. So many of the interventions, thankfully, that save lives also save brains, which is the mitigating effect on the U.S. government's almost single-minded focus on survival. I'm not saying that's not important. I'm just saying people need to survive and thrive. And finally, in Every Woman, Every Child, the Secretary General's initiative, the Global Strategy for Women and Children's Health and Adolescents Health, the kind of moniker is survive, thrive, and transform. So the UN system even has kind of gotten the idea that survival alone is not sufficient. You have to survive and thrive. And this is an area where you could make a recommendation that's economically linked for USAID, for U.S. government policies in development. Obviously, it hasn't been completely ignored, but I think maybe more than other actors, the U.S. government is focused on survival more so than thrival.
Thank you. Linda?
I think given the late, so late, I probably should just make a comment because I think everything, everything you have been talking about this panel has been right on, and it's great to hear from you because. The comment is somewhat self-purpose, that I've been making this case to this committee, the need for a cross-cutting infrastructure that is not specific to an application, that is agnostic to disease and discipline and leverage the private sector in a way. And so I want to just reinforce that and acknowledge that the points that you guys made and the example, the important things that the example you've shown that worked. But I think there is an opportunity. I think I disagree a little bit, Peter, with what you said, because I think there is need to have very specific recommendation that we invest in long-lasting infrastructure on the digital infrastructure side, because it's so easy to jump to that point-of-care application where you can show immediate results, and we focus on that because we all need to care about that, and then it becomes very easy not to worry about building that infrastructure that will prepare us for tomorrow, not just today. So I think, to your point, Sarah, we have to design and build not just for what we need today, but 5 years down the road, and that's where the infrastructure comes in.
Yeah, so thank you. And when the first comment came up around, what is it that we want to achieve and what's a clear recommendation, I was thinking, to have a recommendation that would come out that say that we need to invest in end-to-end kind of up and down the health system, the global health system chain, connected digital solutions for health information, reporting, education, surveillance, and response. Again, like those tools are all out there. What is not happening is having them put together in a connected, coordinated way that's looked at what are the best at each of those steps along the way at doing the functionality that we want to have, and how can we put it together and invest in an end-to-end solution that can be then adapted from country to country and location to location. And that would be, I think, something like that would be an incredibly powerful recommendation that could then start kind of coalescing the resources and the attention required to take advantage of the amazing innovations that are out there that are doing incredible work in different areas of this.
And just adding to, Amy and I have talked about this, whether this then represent the investment domestically or globally. And in fact, this is one place that we don't have it domestically. And if we build a cross-cutting infrastructure, digital infrastructure domestically, it is an example of framework that we can provide and share with other countries. And in fact, that's where the technical assistance comes from. And we talked about it this morning, helping those countries to invest in their local resource so that they have that domestic resource to sustain going forward. So we're not just providing aid, we're providing them investment, help them invest in something that they can sustain on their own.
Thank you. Ramanan?
So this has been a very helpful session because it's sort of, and your comments as well, Peter, at the very end, it's making me question whether digital health is really the appropriate foil here for what we're really thinking about. And I'd like to just hear your brief thoughts on it, and Sarah as well. So Sarah, a lot of the stuff you're paying for, maybe you have a different talk on that, which is the transition to how it actually gets into the private sector, implemented, or the entrepreneurship part. I don't know. Did you give a talk at the Grand Challenges meeting in London on this? No, someone was there from USAID giving a very good talk on this stuff. But clearly that is the challenge, because that part has to pay attention to the people, the business model, the money, the entrepreneurship, and then the technology is one piece of that whole thing. So, I mean, obviously, I don't speak for the committee or anything, but I'm just thinking to myself, is that the right foil, or should we be really talking about scaling up innovation through the private sector, because that's what we're really talking about, of which the digital health is really a subset, but it's not the main, point of focus, so to speak. So I'm actually just paraphrasing what Peter said. So, and Peter, you can probably tweet that in 140 characters really fast, right?
Yeah, I mean, I would just reinforce what Ramanan said. If you zero in, mHealth is great. We funded a lot of mHealth. If you zero in on mHealth alone, for me, that kind of gets boring. But at a minimum, and we obviously disagree about that, but at a minimum, realize that the landscape of M-Health is incredibly fragmented. It suffers from pilotitis. There's thousands of M-Health pilots, and every time somebody comes to our program with, please fund this other M-Health application, we kind of, I roll my eyes, because I know that there's 1,000 M-Health pilots, and it's not that none of them scale. The South African example is a really good example of scale. But that's the exception, not the rule. And so if you focus on M-Health, you're really buying yourself alone. You're really buying yourself two problems. And I'm a fan of M-Health. Number one, you're excluding a whole suite of not only other technologies, but other forms of innovation, like behavioral groups that have drastic reductions on maternal mortality, which has no technology in it at all. And second, and you're kind of cutting out things like mental health. You're kind of cutting out some solutions. And then secondly, you're buying yourself a huge pilotitis and scaling problem. Now, if you recognize those two things, fine. I personally think that if you focused your recommendations on M-Health, I probably wouldn't read your report because I know that that's a very small piece of the puzzle. It's important, but that's not where I think the future of innovation and global health in the United States lies alone. So I just stop there, Ravana, and I hope I rose to your challenge in a way that you found acceptable.
Always, always.
Go ahead, Sarah.
And I want to second that and come back to one of my points, which was technology and innovation are not the same thing. And you guys sent over 2 questions, and one was about innovation and the other was about technology in health. And we have to acknowledge that a lot of technology is moving to be mainstream today and is very important. It is not the same thing as innovation. So I would take what Linda said and actually parse this into 3 categories, which are, to Peter's point, there's a ton that is happening in M-Health. It's an important space, and there is specifically a role for, I think, us as the U.S. government to bring partners together to make that more efficient and more effective, and to mainstream it. That is one component of technology in health. There's a next component that is about digital infrastructure, and it is innovative in and of itself to start to think about infrastructure as being an important part of strengthening health systems. That's not how we talk about it today. And I think it's an important piece of how we talk about this and looking ahead to the future. And then the third piece is creating that space for innovation, which I think we really have to carve out. And that space may be technology innovations. It's actually, a lot of the most compelling innovations that I have seen are process or behavior change innovations, not necessarily specific tools or products, although certainly there are great tools and products that have technology or don't have technology. And I would really want this group to take away the importance of carving out that space to bring diversity of expertise together to create that space for continued innovation in looking ahead.
Just clarify, virtual or physical space?
Both.
Can I just make one comment? Yeah, very quickly. So I agree with what Sarah and Peter both said, and I want to be clear that I'm not talking about just a digital solution. I think the digital framework that I talked about actually helps accelerate the non-digital innovations. It can give people, so in the mental health example, the bench that you talked about, it can let people know that the woman is there that day and that they can go in, and then she can record the different people that she saw in the diagnostics, and then that information can be aggregated so you can find out that it's working. So I'm not at all saying that M-Health or digital health is like the silver bullet, but it can create the connectivity that can then help accelerate all of these other innovations that are incredible.
Well, there are no more tents up, and you've done an outstanding job. I want to thank you all very much. He put his tent down.
I know, I saw. I was like, what happened to Peter?
And Amy put her tent down. So that brings us to an end of the day. And I want to really thank the speakers for taking the time, and giving us a lot to think about in terms of how we try to focus this report and hopefully come up with some innovative recommendations as well that can be implemented. So thank you all. And, Peter, I know you're up in Canada, but thank you very much for joining us by video conference. Thank you. Yes.